for those that have more of an irregular sleep schedule. We talk a lot about sleep around sort of normal sleep schedules, but I understand that's not always the case. So we'll give you some tips for those folks. And then also some things to look for, what might prompt you to go and see a sleep professional. So, why would you need to see someone for help, someone like me that works in a sleep center? And then also just what will that look like? What will coming to see someone like me look like if you did need to come and get more help? Next slide. All right, so let's talk about why we sleep. So sleeping, research has shown really that sleeping is an ecological function. What is happening during sleep is that there's a reduction in your brain function and body energy usage, which is constrained by the time needed for food acquisition. So what that means is, really kind of why we sleep and the amount of time we sleep is really based on how much time we need to be awake to eat, to feed ourselves. So I have a little picture of a bat here. This is not the specific bat, but there is a species of bat that sleeps for 22 hours and then it's awake for 2 hours and it runs around and just eats as much as it can and it goes right back to sleep. So that has kind of the function of how much time is actually sleeping is just based on how much time it takes it to eat. And then there's also a species of elephant that's kind of the opposite. It will only sleep for 4 hours and then is awake for 20 hours because it takes that much time to really gather enough food to feed its large body. Of course, humans fall in between, those time frames. The range in amount of time that we need to sleep is really between 6 and 9 hours. The optimal time for longevity, which means length of life, is 7 hours. So that's kind of where that 7-8 hours comes from. That's really optimal time to really have a longer life. But the range is 6 to 9 hours for humans. What's happening during sleep is your body is restoring itself. So restore, restore, restore. Your digestive system is resetting, your brain function, you're clipping off synapses that you no longer need, and your immune system is also resetting. So all of these things are happening during sleep.
So we desperately need to know which type of bat it is. Do you remember which type of bat? Very curious.
I actually don't offhand. I can find it though. It'll take me a second to find it. So I can look that up right at the end of the.
Okay.
It's like an African something or other bat. This is like a common brown bat, this picture. I couldn't find a picture of it.
That's okay.
But I can find it for you, yes.
Okay. Awesome.
All right, so this picture, hold on, I'm just gonna get rid of this. It's covering my thing. There we go. So anytime you see a sleep presentation, you'll usually see this picture. This is a graph that's showing you the normal sleep cycle. And it really is just kind of showing what mechanisms are in play here for normal sleep-wake regulation. The two main mechanisms at play are on the top there. You'll see the yellow arrows coming down. That's your homeostatic sleep drive. And then on the bottom, the blue arrows pointing up is depicting your circadian alerting signal. So, and this time frame that it's showing is a full day. So starting in the morning at 9 a.m. going through the centers is at night, 9, 10 o'clock, and then through the night into the next day. So human beings are designed basically to sleep in this way. So the circadian alerting signal, it will slowly increase as the day goes on, and then it hits an inflection point where then you sleep. And then this, it will relax the signal. The homeostatic sleep drive is basically your body telling you that you need to sleep. You're getting more and more tired. So as the day goes on, you will get more and more tired again till it hits that point and then you sleep. As you get more sleep, the drive will go down, of course, until the next day starts. So this is kind of a normal sleep cycle. It's also based on, you know, there's other things that affect it, including light that you're exposed to, stressors, all this stuff. But in a perfect world, this is what your body will do. You can show me the next
Very
slide.
cool.
So just some effects of poor sleep. So when you're really not getting good sleep, these are some of the effects that it has on your body. So we found that cortisol levels will really rise in your body, which causes stressors. That has a whole cascade of effects, including increasing arthritis symptoms, weight gain. Also, poor sleep can affect your cognition. So including memory. You'll have difficulty remembering things, difficulty learning new things if you're getting poor sleep, mood regulation. So people tend to have more issues with anxiety and depression if they're getting poor sleep, irritability, things like that. Also, more serious issues can be increasing cardiovascular risk. So cardiovascular events like stroke, heart arrhythmias, can be worse in someone that's getting poor sleep, and particularly if someone has a sleep disorder like sleep apnea, which we deal with a lot, and we'll talk about that in a minute here. Other risks, other diseases that have been linked to poor sleep, cancer, diabetes. We have a question mark around dementia because that's not officially been proven, but it had mild cognitive impairment has officially been proven to be linked to poor sleep. So lots of serious issues, certainly with poor sleep.
We actually got a question about strokes and
Sure.
poor sleep in the
Yes.
chat. Does the risk increase while you are getting poor sleep or no sleep, minimal sleep, or the effects, how can I say this? Can the risk factor continue after you start getting normal sleep again? Does that still put you at higher risk, I guess, is what I'm trying to say.
That's a great question. Yeah, I think I understand what you mean. So if your sleep improves, that will, and or if you have a sleep disorder like sleep apnea and we treat it, the risk will come back down. At least as that affects it. There are certainly other risk factors involved with things like stroke, like high blood pressure, diabetes, tobacco use, things like that. So, but in terms of the sleep, yes, if we improve your sleep, if we improve your sleep disorder like sleep apnea, that will lower that risk again.
Awesome.
So important to address. Okay, so kind of in general, some best practices for sleep. This gentleman in the picture here is showing what not to do. And then on the right, I've listed some of really important things. So one really key thing is being consistent. So with your bedtime and your wake time, trying to be as consistent as you can. And then the other key factor too is just allowing enough time to sleep. So some people will, let's just say, go to bed at midnight and they have to get up at 5 a.m. So that's 5 hours that you're allowing yourself in bed. You're probably not sleeping that whole time. Now we're squeezing it to 4.5 hours maybe. That's not enough time. So if you have to get up at 5 a.m., you've got to get to bed earlier. If you can't, you have to have another sleep session in there. So we'll talk about that a little bit too. So enough time, 6 to 9 hours. And again, you remember the 7 hours is actually optimal for really more longevity of life or length of life. So bedroom environment, dark and quiet, as best you can. There's so much light in our lives these days. Making everything as dark and quiet as you can. Room darkening shades if you're sleeping during the day, things like that. Avoiding stimulation. So, and I really highlighted no screens. So this is where this guy is really doing a bad thing. He's got his phone on in bed. So that's a big no-no. And I know I've done it. I mean, lots of people do it. But TV, phones, really avoiding that in your bedroom, even before bed as much as possible. A lot of people will watch TV before bed, and that's okay, but making sure you're shutting it off, allowing, that light exposure to be limited before bedtime as much time as you can. And I have a lot of patients tell me, I can't fall asleep without the TV. Like I have to fall asleep with it. that's a really common kind of mistake that people make, I would say. When you're falling asleep in front of the TV, you're basically training your body. It's a maladaptive behavior. So you're training your body that's okay to fall asleep in this situation, but you're exposing yourself to light around bedtime. You're exposing yourself to noises. So all that stimulation is really bad for your circadian rhythm, for melatonin secretion. So those natural processes will be impeded by it. So even though you fall asleep because you're so exhausted, you're then more likely to wake up, because you've been exposing yourself to that. So no TV, no TV, no TV. I can't, emphasize that enough. Or screens, really. People use phones a lot now too. All right, otherwise, yeah.
So if somebody is very, very, very used to using a screen to fall asleep, how do
Yes.
they stop? Because, sometimes we fall into that for a reason, right? I remember I went through a long
Yeah.
stint of that. There was a death in the family. I couldn't shut
Yeah.
my brain off without putting something else in.
Yeah.
So I'd fall
Yeah.
asleep watching Friends every night. And, I was going with the any sleep is better than none theory. But how would you transition yourself off if you're up
Yeah,
against
that's
that?
a good question. And I think that's hard because, like I said, you've adapted yourself to this. You know, I would start by cutting it down. If you're doing hours of it, cut down the time, start to slowly separate it from your bedroom, like watch it in another room. And or replacing it with something else that's a better, safer method, like a white noise, like a fan, even like a podcast or something kind of mundane where someone's just talking. So trying to replace it, but it can be hard, and that's where maybe getting help. So with what's called the CBTI therapist. So we'll talk about that a little bit when we talk about insomnia.
Okay.
But yeah. And then so
Great.
just some other tips, regular meals, making sure your belly is full before you go to bed, not being hungry when you're going to bed, but limiting liquids before bed. So if you have issues, especially with any bladder stuff, limiting liquids before bed can help. And then also caffeine, alcohol, tobacco, all of those things can affect your sleep. Caffeine and tobacco being stimulants, and then alcohol certainly being a depressant, can really affect your sleep. Exercising regularly can help. Definitely what exercise does is it actually increases the homeostatic sleep drive. So it's going to make you more tired and make you more able to sleep at night. Slide.
We did also get a question about e-readers and the amount of light that they put out compared to a phone. What are
Yep.
your thoughts on that?
Like a Kindle or yep.
Mhm.
That's a great question. So I think a lot of the e-readers now are actually pretty advanced in that they're limiting like the blue light exposure and things like that. But my understanding is it's still light, that you're putting on your face. So it still can affect it. Although we think that reading a regular book with light on the book is a little bit better versus the light being emitted at your face. But e-readers are not as bad as a TV, as a phone, definitely. But if you're struggling to sleep, then you got to look at these things, They
Okay.
really, a really purist sleep, professional will say none of that in bed, not even a hard book. So really just, for sleep and sex, that's what bed is for. But all right, let's go to the next slide. We'll try to move along a little bit.
Okay.
And then, so someone that has an irregular sleep schedule, this is where it can be really challenging. If you don't fall into that kind of normal day pattern of wakeness and night pattern of sleep. What I tell people is just try to be as consistent as possible. If you normally work second shift and you're getting home at midnight, 1 o'clock, make sure you're having enough time to get enough sleep, in that chunk, or break it up into sections, but be as consistent as you can. Mimic the environment of a natural circadian rhythm. So what this just means is like, if you have to sleep during the day, get room darkening shades, make sure the distractions are limited. It's hard because everyone else is awake. There's more noise, all this stuff, but, do your best to kind of mimic that normal environment that your brain thinks that, you want to be in. And then, like I said, if you can't do 7 hours all in one session, break it up, get your 5 hours and then make sure you're able to take a 2-hour nap in there. That's not ideal, but cumulatively it will help. And like I said, plan naps, and just talk to your boss. If this really isn't working, you're really not feeling good, you're not healthy. Do you need to change your schedule? Do you need to get into a different position? What are the things that can help with that? Next slide. All right. And then what does it look like? If you need to reach out to a professional, what are the things you need to be kind of thinking about? So the big one is poor sleep affecting your life or your bed partner or others? So that can just be kind of an indication that you might need more help. Other big signs and symptoms of concern to look for is something like snoring. Are you stopping breathing? Has someone told you they hear you pause? Or the concern that you're not breathing at night? Are you waking up gasping? Are you really tired during the day, or daytime sleepiness, or during your period of wake? When you're driving, do you feel drowsy? What about headaches? Are you having a lot more headaches? Are you waking up with headaches? That can be a sign that you have a major issue with sleep and you need to get help. Also attention difficulty. So we've had even children that are diagnosed with ADHD and they have sleep apnea. Once we treat the sleep apnea, it actually improves their attention capabilities during the day. So looking at that, and even for adults too, for sure. But yeah, coming to see us if you have any big red flags for sure.
Good to know.
Yeah, and then how to reach out for professional help. So typically the normal pathway is starting with a primary care provider. A primary care provider will send a referral to a sleep specialist like myself. We get referrals though from other specialists as well. Cardiology sends us a lot of patients, sometimes emergency room physicians, ENTs. They come from lots of places, but PCPs are the number one referral avenue. And then you get a referral to someone like me, a sleep specialist. There are some online resources too, including some sleep practices that are solely online. So you can get sleep testing and whatnot and see a sleep specialist online. Certainly I work in a, brick and mortar through a hospital sleep center. So in my mind, that's better. But some people's, schedules really aren't amenable to that, to coming to see me during the day. The other thing too, so some of the online options are all out of pocket, so they don't always take insurance. So that can be a disadvantage, but certainly more flexibility with those. So, all right, next up. And then professional help with sleep. What does that look like? So if you come to see someone like me, you basically, first step is really, we start with a consult. You would come into my office and we have a discussion about your sleep, your patterns, what are the symptoms you're having. And then typically we will do sleep testing, or a sleep study. There are two main types of sleep studies. One is a home test where you wear a simple device at home. There's also an in-lab sleep study. That's what this little cartoon over the left is depicting, as an in-lab sleep study. Certainly it's not that wild anymore, but it's similar. We do hook you up to a lot of wires. There's not a camera in your face and two other guys in the other room, looking at you, but anyway, it is a number of wires. We do have ways around that in terms of medicating people when they come in and things like that to help you sleep when you're here. And so anyway, so we'll do a sleep study. And then once the testing is done, we follow up, review all the results, and then we prescribe treatment as needed. So if we do find that you have a sleep disorder, then we talk about treatment. And I'll kind of go over some of the main things that we see in the sleep center here. The next slide. So these are kind of the top 4, I would say, diagnoses that we see in the sleep center. We certainly deal with a plethora of other things that are much more rare, but sleep apnea is number 1, specifically obstructive sleep apnea. There is another form of sleep apnea called central sleep apnea, which we do see as well. It's just a lot more rare. But sleep apnea, insomnia, restless legs, and then narcolepsy are the top 4 things, and probably in that order as well in terms of the number 1 versus number 4. All right, so sleep apnea, I'll just kind of show you, a lot of people are concerned when they come to see me. If we find sleep apnea, you're going to put me on this Darth Vader mask. Like they're so nervous about it. I like this picture because this is a CPAP. This guy is on CPAP right here. The mask that he has is a nasal mask. So as you can see, it's much slimmer than you would think. It's a little thicker than maybe like a little oxygen cannula. But certainly I think I could sleep with that on my face. So CPAP or BiPAP is the usually first line treatment for sleep apnea, and or like the gold standard of treatment. So if we find sleep apnea, this is often a place that we will start, but it depends on severity level too. If you have more milder case, we don't always jump to CPAP, but if it's more moderate to severe, usually this is where we would start. So next slide.
Oops, sorry, I went two
Yep.
over.
Okay, one back. These are all the fun pictures. So, and I put this all out there too, because I like to tell people, you're not necessarily going to get stuck with CPAP. There are lots of options out there. So these are some of the other treatments that we use for sleep apnea. So on the left there, the mandibular advancement device, or we call it oral appliance. It's basically a custom molded mouthpiece that sits on your teeth, and it just helps keep your bottom jaw in a fixed position, typically slightly forward. So you can see that picture there on the bottom. It's maintaining a nice open airway with that. This is a really good option for more milder sleep apnea, or for someone with more moderate to severe that can't tolerate CPAP. The one in the middle there, hypoglossal nerve stimulation. So that's the Inspire device. That's an implantable device. So it's surgically implanted. What it does is it stimulates your tongue to actually protrude forward, synchronized with your breath at night. This is for moderate to severe cases of sleep apnea who've tried and failed CPAP therapy. So this is a secondary option, but a good option for someone that really can't handle having a bunch of stuff on their face. So that's out there now. Weight loss, certainly, good old fashioned diet and exercise. We typically recommend this in any of our patients that are obese because it can help with sleep apnea. Zepbound has been approved, which is tirzepatide for sleep apnea. So that's one of the injectables. There's certain criteria you have to meet to be able to get that through us, but that's one of the options out there now too. Next slide. And then other treatment. So positional therapy is considered a conservative treatment, which you avoid sleeping on your back. Typically, patients with sleep apnea, obstructive sleep apnea, have worse symptoms on their back. As you can imagine, gravity just pulls everything down, and your airway is more likely to collapse in that position. So you can buy these devices, typically, like a kind of a bolstering device that prevents you from rolling. The one on the bottom there is a device that gives a little stimulation or vibration. Basically, when you roll to your back, it'll vibrate, which tells you that you need to roll to your side. Surgical options. So that picture on the top, as you can see, really large tonsils. That can cause sleep apnea. So if we find that in someone, we usually send them to ENT, and have those removed. That can open up the airway. The lady on the bottom there had mandibular advancement surgery. So that's where, as you can see the picture to the left, her jaw was severely recessed back. And you can imagine that really closes off your airway. Once that was moved forward, she has a nice open airway. Of course, it changes the look of your face. So that's a big one, but it can really help. So for someone in that situation. And then another alternative one, I like this picture here. So there's actually been science research, academic research on using the didgeridoo. So that's what that guy is playing there. It's a Aboriginal wind instrument that it has been shown to really strengthen the muscles, in your soft palate, which can help with sleep apnea. But it's not a great treatment, but it's out there. So, and then insomnia. So our number 2 thing that we see is insomnia. Basically, insomnia is difficulty falling asleep or staying asleep. I could do a whole talk for many days on insomnia. But what I'd like to really emphasize to people is the mainstay of insomnia treatment is not medications. A lot of people will come in, well, what can I take? What can I take? I've tried melatonin, I've tried this. You really want to start from the basics. Sleep hygiene is number 1. So And that was what I had talked about at the beginning there, consistent bedtime and wake time, limiting screens, all these kind of things can really help with insomnia. If you need more advanced help, CBTI therapy is actually the first line treatment for insomnia. So what CBTI stands for is cognitive behavioral therapy for insomnia. So it's basically a system of therapy techniques that helps adapt your behaviors, your beliefs around sleep and insomnia. So that sounds like kind of a lot, but ways to do that really is you can meet with a professional therapist that's trained in this technique. So you can do an in-person CBTI sessions. There's also an online, televideo CBTI therapist that you can use. That's through Psychology Today. That's a good resource for that. There's also some just online apps that you can use. So I just listed CBTI Coach because that's one that we like. It's a free app put out by the VA that you enter in information and then it gives you feedback for insomnia. There's other ones out there. I have a whole list of them, but yeah, CBTI is the mainstay for insomnia. So I tell everyone, start with that. Last resort is medication. If you're doing really good sleep hygiene, you're still struggling to fall asleep or stay asleep, then we talk about medications. Some over-the-counter medications are listed there, and then certainly prescription medications as well. And we have a plethora of those to use as well. And then restless legs is probably the next most common thing that we see. And restless legs can be correlated with sleep apnea. So if we also find sleep apnea, we usually focus on treating that first. But certainly if you're still having a hard time keeping your legs still, you're kicking your bed partner, you're feeling really tired and everything else is controlled, we usually recommend that people get some blood work done to rule out other causes. So other causes of restless legs, anemia, hypothyroidism, we want to make sure that those are normal. If those are all normal, we can prescribe medication for restless legs, gabapentin, ropinirole, pramipexole, and then conservative treatment to applying heat to your legs, stretching. There's also, I didn't list this here, but there's like a TENS unit, which is a device that gives electrical impulses that is recommended for restless legs too. So that's something else that you can use. All right, and then narcolepsy. So narcolepsy is a lot more rare, but it is definitely a serious sleep disorder that we see. Basically, kind of in a nutshell, what it is your brain is a little bit mixed up as when you need to sleep. So during the daytime, you're more likely to want to sleep, and at night you can be more likely to try to be awake. So mainstay of narcolepsy, again, sleep hygiene, being really good with consistent bedtime, wake time, all of that. Also, some patients with narcolepsy they have to have planned naps. So, we recommend a 1 to 2 hour nap at least once a day. If someone has narcolepsy, that can really be refreshing to this person. And then medication wise, so the mainstay of that is wake promoting agents. So Provigil, Nuvigil, you don't need to know the names of these, but sometimes stimulant medications too, like methylphenidate, which is Ritalin or Adderall. And there's other ones too. There's a whole bunch of prescriptions now for this. And then support, because narcolepsy can be really challenging. Someone that's trying to work and, have a normal life, if they need to fall asleep during the day, that can be really hard. So having emotional support and family support. And the reason there's a goat in this picture is because there is a type of goat that has been genetically engineered or bred to have the gene for narcolepsy. So basically what they'll do is, or they're called fainting goats is a common term for them. So, they were bred basically to save the more, the livestock that they're prized livestock. So the fainting goats would be a decoy, basically. If they're stressed by something, they hear a loud noise, they just fall down. So that's a narcoleptic goat. This picture isn't one, but I used to own some. All right, so final tips and takeaway. Sleep is important. So sleep is so important, we believe, for general life and health. Don't forget sleep hygiene. Every aspect of sleep can often, or often it can come back to just sleep hygiene. And then ask for help if you have any of the big red flags like snoring, stopping breathing, restless legs, anything, come and see me or another sleep specialist, and often start with your primary, but ask for help if you need it.
Brooke, I know we've gone a little bit over, but do you have
Yep.
time for a question or
Yeah, of course.
two? Okay, there's
Absolutely.
a couple of really good ones in the chat here. I just wanted to address it before we lose too many people. But the question is dreaming, well, it's about sleep quality. So the question is
Yes.
does dreaming mean one is getting good sleep even though dreams may be stressful or nightmares? How do we know if we got good quality sleep?
That's a great question. So, we actually don't know a lot about dreaming. So, and specifically the sleep stages, we still actually don't really know. There is some general thoughts about dreaming and or deep sleep that is really where the quality sleep happens, but it's not been proven. So we're not really sure actually if you need to dream and or if you need to really get a lot of deep sleep. Um, I, I think that it's important, but the problem is if you're having more dreams that are disturbing, like nightmares, it actually can work against you because it can cause awakenings. The thing about dreaming, though, so if you have disturbing dreams, if you have no dreams at all, that can be an indication actually that you have another sleep disorder. So people with sleep apnea often don't dream at all because they're not getting into deeper sleep. They're not getting into REM sleep. And then certainly disturbing dreams, that can be disruptive to your sleep as well. So addressing that sometimes with therapy, sometimes with medications, but also getting evaluated. Is something else going on? Another, interesting thing. So I didn't mention this because this is fairly rare. You can have this thing called REM behavior disorder. So if you're dreaming and you're acting out dreams, so if you're punching and kicking, thrashing around, getting out of bed, sleepwalking and talking, things like that, that can be indicative of REM behavior disorder. That can open up a whole nother can of worms because it can increase your risk for Parkinson's disease. So anyone that has anything like that, with vivid dreams, really concerning dreams, it wouldn't hurt to come see a sleep specialist. But otherwise, we actually don't know. I don't have an answer for you about how important dreaming is or even stages. We don't know. There's been a lot of research on it, but we haven't quite figured it out yet. So,
Is there a perfect time of day to exercise for sleep?
oh, that's a good question. I don't think there's a perfect time of day, but what I would say is right before bed is not perfect. So if I would avoid any time, it would be right before bed, just because exercise is stimulating your body. You're getting your heart rate up, your pulse up, all of that stuff. So probably any time during the day, except before bed, except for an hour or two before bedtime, I would avoid. And that's hard because some people, that's the free time that you have. But yeah.
And then we have a couple of questions about, was this marketing? Is this actually useful for sleep? And the first one is, I've heard that dim red or orange light may be helpful, like a salt lamp, but I don't know if that's marketing or just actually good information.
That's a good question. I don't know. I don't know how well that's been researched, or I don't actually have an answer for that. Light in general is not good for sleep. I would say that. There's some stuff out there about like the blue versus, like you said, the dimmer light. I think the salt lamps, what they're doing really is like emitting other um ions and stuff that probably are good for sleep, but I don't really know. I don't have a good answer for that. If you
Okay.
find that it helps you with sleep, great. I mean, it can be more of a personal thing, but research wise, I don't know if it's adversely affecting your sleep, then I would avoid it. But
Mm-hmm.
yeah,
All
maybe
right.
exposing yourself to it during the day, that definitely should be fine. I don't know about right during when you're trying to sleep, whether that's good or not. I would assume no, but
Okay.
Yeah, probably marketing. There's tons of stuff out there.
A lot of marketing. Because of all the marketing, we've got another question here.
Yeah.
Is going outside for at least 10 minutes within the first hour of your day vital? How important is that?
A good
Is it
question.
important?
I think it's definitely important to be outside as much as you can, actually, other than exposing yourself to harmful UV radiation. But yes, and it can definitely help with sleep. Time frame throughout the day, I don't know exactly, when it's best to do that, but getting outside, definitely good for sleep. Specifically when or how much, I don't know. I don't have an answer to that.
Okay, beautiful. And then is there any night timing of going outside and seeing that natural light fade that's useful that you know of?
Yeah, that's a good question too. I don't know specifically, but at least an hour before bedtime.
Hmm.
So, the natural light will obviously change. And if you live in an area more in the, further north, then it's hard to have the natural light be in a normal pattern, where they have days of light. So, but typically 1 to 2 hours before bed. So I tell people manipulate your environment as such. So if you're at home in that time frame, make your lights dimmer, an hour to 2 hours before bedtime. That starts signaling your circadian rhythm that it's starting to get towards bedtime. So dim lights as much as possible, 1 to 2 hours before bed, I would say, if you're in control of it. The natural environment is harder though to control.
Yeah, fair. And then what about over-the-counter style sleep medication, supplements, suggestions on whether they're relevant or how to find ones that we could trust, and then also have some questions on how to stop taking over the counters like Unisom.
Yeah, so over the counter stuff in general, is not completely well researched. I think that's the issue with it. Some will help people, but not always. I'm going to give you a really general response to this. So Unisom, actually, so the biggest concern I have about over the counters is those that contain Benadryl, so diphenhydramine. I'm not, so like Advil PM, a lot of people will use, or even NyQuil, which has diphenhydramine in it. I'm not actually 100% sure about Unisom, what the ingredients are in that. I'm going to look it up right now. Oh, it's doxylamine succinate. So that is an antihistamine. So that's in the same family actually as Benadryl. I don't know specifically about the doxylamine that's in Unisom, but at least the antihistamine properties that are in Benadryl, regular use of diphenhydramine or that antihistamine can be harmful. So it can increase your risk of dementia. So I really strongly advise people against using those medications regularly. Like I said, the challenging thing is all of these medications are geared towards insomnia, and medication is not first-line treatment for insomnia. So working on the basics of sleep hygiene, seeing a CBTI therapist, doing an online CBTI program first before trying any of these medications is actually better for long-term improvement of insomnia. But otherwise, mixed results from a lot of the over-the-counter stuff. So even melatonin, some people it works wonderfully for, others it does nothing, or others it stimulates them. So it can be really hard to kind of guide that specifically. But there's a lot of stuff out there too, like herbal stuff, valerian root, ashwagandha, things that can help with calming, so I think there's nothing wrong with trying those things, and or having, a tea with a valerian root, before bedtime, as long as it's not too much liquid. But so yeah, those things can help, but that's such a loaded question for me because I'm like, you really need to work on the other things first.
So it
But
sounds
be
like
cautious with
individual.
over the counters, you know, and be cautious with over the counters too, because I think the other thing is they're not regulated. So, you know, anybody can kind of put this stuff out there. Look for ones that have been evaluated by another, you know, by an outside agency, you know, or by a,
Like third party tested.
correct. Yeah, exactly. So look for quality brands, you know, things like that. Certainly they're more costly. But you know, getting even melatonin, you know, from Dollar General, generic brand, like, it's probably not going to work that well. So yeah, if that helps
And if
answer that.
somebody's, yeah, and if somebody's having difficulty getting off of something, maybe that's more of a one-on-one support kind of situation.
Sure. If it's something that you have now, you know, become addicted to or built a habit to, you know, then that can be something that you really need to talk to somebody about. And I find the ones like the diphenhydramine, so the Benadryl containing ones are one of the ones that causes that. You know, and part of that again is maladaptive behavior. So you've now trained your brain that you have to take this to fall asleep. And it's really working on other strategies that you can put in there to replace that medication. So that probably needs more help. But yeah, it can be hard.
Well, thank you so much. I think that is all of the questions. And folks, if I missed one of your questions, it's not personal. It was an accident. Thank you so much, Brooke.
You got to do my
This
last
was
slide before
fabulous.
we go. There we go. That's my little man. That's why I wasn't here 2 weeks ago, because he was sick at daycare.
He's so cute.
Anyway, thank you guys so
Take
much for
care.
having me. Appreciate it.